The Afro-European Medical and Research Network, a group of dedicated healthcare providers who is making significant strides in improving healthcare access for underserved communities worldwide, with its headquarters in Geneva and branches in various countries. This accredited organization has been at the forefront of providing medical services to those in need. In an interview with Star Television, the president of the Afro-European Medical and Research Network, Dr. Charles Senesi, who also served as the Deputy Minister 1 of the Ministry of Health and Sanitation, gave an insight into the organization's activities.
Which is basically a network of professionals from the health sector who are based all over the world and determined to give back to their country or continent of origin. And then we go according to 1948 definition of health. That means it's not only the absence of disease or infirmity, but really that complete social, physical, and mental well-being. And so, which means you don't need to be a doctor, a nurse to support health initiatives. You can be an engineer, you can be a politician, you can be an accountant, you can be anything that can actually support the provision of adequate healthcare delivery system. And then most of people who happen to live outside their countries or continents of origin, we are always poised to give back to our origin in whatever forms. We as physicians, as doctors, as nurses, we have decided to do that in the form of the Diaspora Medical Mission with mobile clinics, which is an initiative of the Afro-European Medical and Research Network, which I founded about 18 years ago in Switzerland. But I've been involved in the humanitarian healthcare delivery for the past almost 35 years. And then it all started when I was a medical doctor, when I was a medical student in Sierra Leone, where I studied my medicine. I saw the need. I was a student union president. We used to do Student Week of Action. We used to go out into the community to help people, Cheshire Home to help the disabled people, and bring healthcare to them as well. And then I had the idea that why don't you also extend it to the provinces? Because there it is difficult, so much is centralized in Freetown. So we decided to have we used to call it medical camp. And that was in the early 90s. We had the first one, it was 1993. We went to Moyamba. We went to Tombo first. And then the next year we went to Moyamba, 1995. And then 96 we were in Port Loko. But then the war forced us to stop, which means a group of medical students, nursing students, Fuabe College students from all the higher institutions of learning, we go to a particular locality and we stay there for about a month. We run mobile clinics in the villages. We actually increase the health awareness of the people. We increase their health-seeking behavior so that at least they can appreciate westernized medicine as against what we operate in the villages. And so when I finally found myself in Switzerland in the early 2000s, I set up this Afro-European Medical and Research Network. Research is a very key component of what we do in this part everywhere. If you can document your treatment modalities, the way you see patients, and present them, that's all research. You can do the bench research or the operative research. So I founded Afro-European Medical and Research Network, and then I work with the WHO, which is also based in Geneva. So I became affiliated with the WHO because you have to align yourself with the custodian of the health of the world. I aligned myself with the WHO, and then I work, it's medical and research network, which means I cut across every department within the WHO in making sure that the healthcare delivery system to low and middle income countries is optimized. And we use the Diaspora Medical Mission with mobile clinics as an entry point.
According to Professor Dr. Charles Senesi, the president of Afro-European Medical and Research Network, said since the inception, the organization has been committed to addressing the unique challenges faced by communities, particularly in rural areas. The organization, he said, comprises of doctors, specialists, nurses, dentists, laboratory experts, and medical researchers, all united in their goal to improve the healthcare and well-being of individuals across the globe.
And then I remember the first one we did was about 2008 on HIV/AIDS, which was affecting the country. And we aligned ourselves with all the main players in HIV/AIDS in Switzerland and the world beyond. And I've been working in Kenya, running these mobile clinics. I've worked all over sub-Saharan Africa for the past 16, 17 years. I've been doing that. And then I've happened to come back to Sierra Leone, and of course, before I came back to Sierra Leone, I've been running these clinics again. In 2013, we were in Kenema district, and with late Dr. Khan, may his soul rest in perfect peace. He was my medical coordinator. And then then came the corona. I could no longer come to Sierra Leone because of the Ebola, sorry. So I was helping from WHO as consultant, using my medical and research network to recruit people from Ebola experienced countries like Congo, Uganda. Some of them are still working at the WHO that I help recruit to come and help my country, also other Sierra Leoneans and organizations. And so that's what we are doing. And so basically, being back in Sierra Leone, we came with the medical team through the IEMR, International Organization for Migration. In 2017, we were in Kabbalah with a big team. Normally, we have physicians, dermatologists, we have critical care medicines, we have surgeons, we have obstetrician gynecologists, we have ophthalmologists, we have dental team that normally come with us, we have researchers in clinical trials and other areas, laboratory medicine. It's a whole team we normally come with, depend on those who have time at that particular time where we are coming down. So 2017, we were in Kabbalah, Koinadugu. We ran clinics in the small villages, Kubola, etc. 2018, we came with similar team in Kailon and all the chiefdoms around Kailon district. And then 2019, we were in Moyamba with a big team. We helped set up a new Delta unit there in Moyamba. And 2020, we could not come because of the corona. It was hitting us. But 2021, we could no longer be controlled by the corona. We came again, we went to Karina, to the new district, very far, very challenging. But that is where we want to be, to bring health to the people who could not, under normal circumstances, cannot access the healthcare delivery system, increase their healthcare behavior. And when we come again with the medical team, we take young doctors and specialists in country, so we have that skill transfer and exchange between us and contact, so that they profit from our knowledge even when we return back from other amenities or facilities we send. And that's what we do. And so 2021, we were in Karine. 2022, we were in Banff, both mainland as well as the island on the districts. And 2023 now, we are in Kenema district, whole of Kenema district, including Pangoma, where myself, I was there with a big team as usual.
According to Professor Dr. Charles Sedasi, the president of Afro-European Medical and Research Network, concluded it has become evident that the organization's commitment to improving healthcare access remains unwavering. Through their relentless efforts, the Afro-European Medical Research Network continues to make a tangible difference in the lives of those who need it most. With each intervention, they bring hope, healing, and brighter future to the underserved communities worldwide. For Star TV News and Freetown, George Elliott Sam reporting.